Hi, everyone. It is now 2 p.m. Eastern Time, and you have joined the Justice and Mental Health Collaboration Program Category 2 orientation webinar. To allow for late arrivals, we will begin in just a few minutes. Thank you. Hi, everyone. Thank you for joining the FY19 Category 2 Law Enforcement Strategic Planning Grantee Orientation. Congratulations to all of our grantees. We are looking forward to working with you. Next slide, please. Today's speakers, we have Maria Fryer from DJA. She is a policy advisor. We also have myself, Laura Fabius. I am a policy analyst on a law enforcement team here at CSG. We also have Olivia Randy, also a policy analyst at CSG, and Ms. Carol from the Miami-Dade County, Florida. She's Vice President of Behavioral Health Services. Next slide. During today's presentations, we are going to introduce ourselves in our DJA's role in the grant, go over the grant overview and the police and mental health collaboration framework, go over technical assistance, and then we will also have a feature grantee, Miami-Dade County. They were FY17 planning grantee, and now they are FY19 Category 3 implementation and expansion grantee. And we will also have a question and answer session. If you have any technical difficulties, apologies, or audio problems during this webinar, please contact WebEx Technical Support at 1-866-229-3239. Once again, the number is 1-866-229-3239. During our question and answer sessions at the end of the presentation, please type in your question on the bottom right-hand corner of your screen. We will make sure to get your questions and answer the questions. If for whatever reason we miss your question or we're not able to answer your questions during this presentation, please follow up with one of us. Our contact information will be shown at the end of this presentation, and we will make sure to answer your questions. Thank you. Next slide. So who are we? The Council of State Government Justice Center, or CSG. We are a nonprofit, nonpartisan membership association of state government officials. We represent all three branches of government and provide practical advice from the best available evidence. Now I will pass it on to Ms. Maria Fryer from BJA, and she'll give us a little background about herself and also the Justice and Mental Health Collaboration Program. Maria?
Great. Great. Thank you very much, Laura, and welcome everyone to the webinar today. As you may know, my name is Maria Fryer, and I want to welcome you and congratulate you on the success of your award. We're so excited to have such an interesting group of grantees focusing on building and enhancing response across the country. And as you may remember from our other webinars that we've held earlier, I work in the policy office at the Bureau of Justice Assistance as a policy advisor for justice systems and mental health. And I oversee a number of programs pertaining to the intersection of mental health and co-occurring disorders with people in the criminal justice system. So a little bit about the Justice and Mental Health Collaboration Program. As I mentioned, although the needs of states and tribes and local communities continue to evolve and change, the Justice and Mental Health Collaboration Program still remains one of the primary sources of funding and a driver of change for people with mental illness and co-occurring mental illness and substance use in the justice system. And it's legislated to be the main source of federal funding that supports justice system professionals in their response to people with mental illness. And the Justice and Mental Health Collaboration Program supports activities such as direct training for law enforcement and for prosecutors, probation, and judges. And it also guides policy and leadership and best practices and collaborative system development through the state capacity building and through the training and technical assistance program with the Council of State Governments Justice Center. And allowable programming activities under JMHCP follow what you may be familiar with, the sequential intercept model. I'm sure you are. And the JMHCP follows this model in the way that it can be used to address the needs of people with mental illness anywhere along the criminal justice continuum or at any phase or intercept where they can be identified as having mental illness and appropriately diverted. We've been focusing on the front end of the system, on intercept 0 and 1 very heavily, of course, as you can imagine, to prevent people from going further into the system. So all of you and the work that you do is so incredibly important to us here at BJA. And I just wanted to thank you for being on the webinar and congratulate you once again. Next slide. And as you can see, the mission of the Bureau of Justice Assistance is definitely to help through our funding and our policies to make communities safer and strengthen the nation's criminal justice system through all that we offer through our office and our partnerships to provide you with the latest in tools and best practices to reduce violent and drug-related crime, and of course to support all of you in the work that you do through your law enforcement and behavioral health partnerships and to combat victimization. Thank you so much.
Thank you so much, Maria, for that. And as you can see, the Justice and Mental Health Collaboration Program supporting law enforcement since the beginning of this. They have supported 116 law enforcement agencies. They have used their funding to establish PMHD models. And since 2017, 24 sites have received funding to train law enforcement and related staff members. Next slide. I will now turn it over to Olivia, who will go through the beginning part of our framework. Olivia?
Great. Thanks, Laura. Hi, everyone, and thanks for joining. My name is Olivia Randy, and I'm a technical assistance provider here at the CSG Justice Center, and I'm looking forward to working with you all. So today we're really excited to welcome all of you. Congratulations on your award. Your grant is one of 8 new 2019 Category 2 grants from across the country, including Phoenix, Arizona, the Division of Criminal Justice in Colorado, Warren County in Kentucky, Boston, Massachusetts, City of Muskegon in Michigan, City of St. Louis in Missouri, Clemson University in South Carolina, and the City of Lubbock in Texas. And as Laura mentioned, there are over 100 previous law enforcement grantees, so we're really glad that you're all joining as a cohort, and we look forward to helping you, make connections with other grantees, both past and present. So this grant supports strategic planning for police mental health collaborations. So what does that really mean? Really it includes 4 main focus areas or kind of buckets of activities that are supported through this grant. So that includes reviewing and assessing mental health related policies and procedures, developing a plan for training in mental health related topics, building or enhancing a data collection system, and typically this is to improve information that's collected on mental health related calls or encounters, or also to share information with other agencies. And last but not least, partnering with mental health agencies in the community, which is really kind of foundational to this grant. So to guide these efforts, in collaboration with BJA, we've developed the Police Mental Health Collaboration Framework. This framework outlines the key components of a comprehensive PMHC and was developed in collaboration with some of the most advanced PMHCs in the country. So really the idea of this framework is to support initiatives in starting up a PMHC, but really moving beyond just training or one-off programs, but toward a more robust agency-wide or even cross-agency PMHC strategy. This framework was really written with law enforcement executives in mind, so that ideally they would be able to work with local government leaders and then also form partnerships with behavioral health agencies and then oversee operations within the law enforcement agency. So the framework is organized by 6 questions, which are really the key components that should be considered to develop a comprehensive PMHC. So those questions are, is our leadership committed? Do we have clear policies and procedures to respond to people who have mental health needs? Do we have staff with quality mental health and stabilization training? Does the community have a full array of mental health services and supports? Do we collect and analyze data to measure our progress? And do we have a formalized process for reviewing and improving performance? There's also an emphasis within the framework on the importance of using data to guide your PMHC. So collecting the right data can help you to identify successes and guide your performance improvements and eventually demonstrate the value of your initiative both internally and externally. So working with local and national agencies, we identified these 4 outcomes as really key to a PMHC's success. So they are increasing connections to resources for people. These are all for people who have mental health needs. So increasing connections to resources, reducing repeat encounters with law enforcement, minimizing arrest, and reducing the use of force in encounters with people who have mental health needs. So while these are the main outcomes that really define success for a PMHC, there are certainly other measures that are important to collect. So you'll see just a few examples listed here. And I'll just point out that the ability to track the number of mental health related calls for service or encounters is a really important measure, and that's kind of foundational to being able to track these other key outcomes. Now I'll pass it back over to Laura to provide some detail on each of the 6 key components from the framework.
Great. Thank you, Olivia. Again, hi, I'm Laura Fabius. I provide technical assistance to law enforcement grantees here at CSG. So leadership commitment, what does it look like? Having law enforcement leadership supports the collaboration. It has strong community partnerships in participation in interagency work groups. To have a designated chairperson or a project coordinator is really important. Having a commitment for funding and resource allocations for the PMHC, and also ongoing recognition, whether internally and externally, is also important for the initiative. Next slide, please. Policies and procedures. So comprehensive process review of individuals through the system, having selected PMHC response models based on your assessed community needs. So not just selecting one, but selecting one that fits the needs of your specific jurisdiction is also really important. Comprehensive, clearly written policies and procedures that is reviewed by personnel and easily accessible, and having information sharing agreements that are in place. Next slide, please. Quality training. Quality training is something that's very important, and that's also a common theme with our grantees. So all staff receive knowledge and skills training. Training is aligned with staff roles and experience. Training is provided through multiple instructional methods, whether simulations or virtual trainings, role plays, and/or site visits. Training is delivered by various instructors, law enforcement personnel, mental health personnel, people with lived experiences, people out in the community, and training is evaluated through pre- and post-testing. Next slide, please. Services and support. So having an inventory of existing services to address crisis and long-term interventions, assessments of services and resources, and prioritizing behavioral health resources and increased funding. Next slide, please. Data collection and analysis. This is something that's also probably one of the most important parts of it. During your TA, your 2-year TA session, we're going to probably be asking a lot about data, because data is the driving force behind getting funding the next year, but also just making sure that the work that's being done is right for your jurisdiction. So work group has established specific metrics to track indicators of progress. Establishing baseline data, that's also really important. Clear processes for collecting and tracking data. Process to identify people with frequent arrests and repeat encounters. So high utilizers, people who frequent, the multiple agencies. Having data sharing agreements in place, and consistent mechanisms or systems to track data. Next slide. Performance review. Establishing a process to review and continually improve PMHD efforts. Routine data-driven performance assessments, shared accountability and coordination, and the leaders use performance measures and outcomes to identify breakdowns and modify policies and procedures. So I know that we kind of went through this a little quick. It's definitely more detail, and during your TA sessions, we're going to be able to break these down depending on the jurisdiction needs and what you want to accomplish. This is a kind of a quick overview of the framework. You'll be able, if you want to get copies of the framework, your TA provider will be able to share that with you. Next slide, please. So technical assistance. I'm going to pass it over back to Olivia. Kind of go over some of the TA assistance that you should expect during your grant.
Great, thanks, Laura. So your TA provider, which you may have gathered by now, your TA provider will be your kind of main point of contact for technical assistance. So we'll be holding monthly check-in calls with you and your grant team, which we have reached out to start scheduling with you all. And these calls just serve as an opportunity to discuss updates on your project, any successes or highlights, and to talk through any challenges and kind of determine where we might be able to help provide you with resources or connections to other sites to help support your project. And then we're also available, at any point throughout the grant to answer any questions as they come up. Throughout the grant, we will host this Learning Community series, which serves as a peer-to-peer learning opportunity for you all as a cohort. And then we can, again, also connect you to current or past JMHCP grantees. And then one of the tools that we'll go through with you is the planning guide, which is designed really around the PMHD framework. And Laura will be going over that in more detail in just a few minutes. So here are just a few examples of some of the publications that are focused on law enforcement and mental health that the CSG Justice Center has released in collaboration with BJA. over the past 10 years or so. And we're developing more resources on a regular basis. So, for example, in the last month or so, we published a web page and a fact sheet on strategies for information sharing between law enforcement and mental health. And these are all available on the CSG Justice Center website. So hope that that would be useful to you, and your TA provider can direct you to those as well. Another great resource to point out is the PMHD Toolkit. So this is a website from the Bureau of Justice Assistance that has a ton of information on PMHDs that could be useful to you. There are a variety of different resources. They're organized around learning, planning and implementing, training, managing, and measuring performance of police mental health collaborations. So I really encourage you to check out that website. And the Law Enforcement Mental Health Learning Site program, this is a program that CSG Justice Center manages with support from the Bureau of Justice Assistance. This may be helpful to you to engage with throughout your grant. So through this project, we've worked with BJA and experts in the field to select 10 different law enforcement agencies across the country that have demonstrated, comprehensive and successful strategies in responding to people with mental illnesses. So this program started in 2010 with 6 sites, and because it was so successful, in 2017 we added 4 new sites. So these sites are national learning sites, and they're available to support other jurisdictions as they're trying to develop or enhance their own PMHCs, so they can respond to calls and emails, they can host site visits, facilitate presentations and trainings, and they also inform a lot of the resources that are developed. So the 10 learning sites are shown here. So Houston Police Department in Texas, Los Angeles, California, Madison, Wisconsin, Portland, Maine, Salt Lake City, Utah, University of Florida Police Department. And then the newer cohort is Arlington Police Department in Massachusetts, Jackson County, Ohio, Madison County, Tennessee, and Tucson, Arizona. So it's likely that many, if not all of you, budgeted for a site visit with one of the learning sites. Many grantees have held site visits with one or more of the learning sites, and we've just heard over and over again how valuable the experience has been. So if you're planning on a site visit, then you can work with your TA provider to help kind of outline what you're hoping to gain from the visit and how you can benefit most from your site visit, and then we can help you identify which site might be the best fit. And then we can help you get in touch with that site. Then I also want to emphasize that, in addition to the site visits, we can help set up a call or connect you via email with the sites to talk through different challenges, throughout your grant. And now I'll pass it to Laura to talk more about the planning guide.
Thank you, Olivia. The planning guide is a tool for grantees and TA providers to understand the status and progress of your grantee's project. The guide works in accordance with the PMHC framework and the 6 questions that we went through a few slides ago. So over the course of your grant, you will complete the monthly exercises, and your TA provider will review them during the monthly check-ins. So this is not meant to be like homework assignments at all. That's like one of the main things I tell my grantees. It's just meant to help you write down and visualize and see where your jurisdiction is, what needs to be done to plan out this process. Hopefully the planning guide will guide you, and help you if your jurisdiction do want to apply for the implementation expansion phase. So it is. Next slide, please. Also in the planning guide is a logic model. The logic model, you and your team will be able to articulate your overall program goals and measurable objectives based on your grant narrative. This will help you visualize the purpose and scope of your activities, the resources needed, and expected outcomes. So over the next month or so, your TA provider will probably send you a copy of the Category 2 planning guide. And during the first couple of calls, just go over the guide with you to see how the exercises are done. And how it could best benefit you. Like I said, we don't want it to be monthly. We don't want it to be homework assignments. We really want these guides to help you plan out your initiative. A lot of my jurisdictions, they've used this to plan out their stakeholders meetings and their work groups. So that's, I would recommend that's also a great way to get some of these exercises done and kind of help mold your meetings going forward. Next slide. The learning communities. So over the course of these 2 years, we will be having 5 learning communities. This will help you connect with subject matter experts. Sometimes we have consultants that come on. We have other staff members who are that do this work. They'll be able to come on. So just on specific topics, either to brainstorm ideas to enhance your programming and troubleshoot challenges. We want these to be interactive, less us talking and giving you guys ideas, but more of you guys coming together as a group to be able to discuss like what's going on in your jurisdiction, what are some of the challenges that you guys are seeing, and to be able to connect with each other. So, we want these learning communities to be a virtual meeting among the FY19 grantee cohort. Next slide. So it'll be 5 webinar web sessions throughout the grant period. It will be brief presentations and hopefully more discussions. We'll have grantee representatives. So we asked out 1 or 2 representatives from your jurisdiction, whether law enforcement or mental health, be on these webinars to be able just to speak and have discussions. The presenters will be from law enforcement, learning sites. So we might have some of the learning sites come on, past JMHCP grantees, and other subject matter experts. Everyone is encouraged to ask questions, share ideas, and offer advice. We say that we tell our grantees, like, don't try to invent the wheel. So we really want to hear from the grantees and see some of the challenges that you guys are having in your particular jurisdiction, because a lot of times we go back during our TA and we share those challenges or we share those ideas with our other grantees. So please, to take heed advice that for these learning communities, we want it to be more of a discussion and more as a way for for you guys to be able to come together and share your ideas, share your challenges and successes to be able to help other jurisdictions. Next slide. So our learning community topics. The first session will be in February. It's just about strategic planning, how to start. We'll have one on information sharing, data collection analysis, and funding and sustainability. Next slide. So for strategic planning, during this learning community, we're going to focus on the process of identifying goals and objectives and formulating a plan to actually attain them. So we would assess your current state, some of the strengths, some of the challenges, the available resources in your jurisdiction, and what improvements can be made. Next slide. Information sharing. Information is one of the challenges, common challenges that we hear with all of our grantees is, what information can be shared, what information cannot be shared. So during this session, we probably will have a past grantee and probably a consultant or someone just to be able to share some ideas. And we want to hear from you guys, the grantees, what specific challenges that you guys are facing in your jurisdiction in terms of information sharing. So some strategies may include interagency agreements, MOUs, case management meetings, universal release forms, embedded clinicians. So that'll be that topic. Next slide. Data collection and analysis. So for our data collection and analysis learning community, last year we had the National Police Foundation. They were actually able to host this and just be able to give some strategic advice on what data collect and how to analyze data. So this is really a great session, and we had some great feedback on this. So reliable data is essential you want to record your program activities and performance. You want to ensure that scarce resources are effectively managed, demonstrating to government decision makers that the program is effective, requesting funding through annual budgets or grants, and garnering the support of mental health providers and community stakeholders. Just a little, example, one of my grantees, they started collecting data on Excel sheet for their core responder model. because they didn't have the funding for a database. And based on just their Excel spreadsheet, they were able to collect some great data and actually go to their chief and their city council and, was able to get funding for the next year for their clinician, just based on the data they were collecting. So data collection is very important. And, we say that, for sustainability and funding, you want to be able to bring to your chief or your city council the work that you guys are doing. Next slide. Funding and sustainability. You want to secure funds, whether it's through a grant, whether it's through your city council. So hopefully this learning community we'll be able to give you some of our strategies or some of our recommendations, some things that we have seen. We'll invite past grantees that were able to secure funding through their jurisdiction to continue the work. So, hopefully this learning community, it would be some great benefits to you guys. Next slide. So next step. So we are planning right now to have our first learning community on February 19th, 2020. Wow, 2020 already. So David Demore, he is the director of special projects here at CSG. He will be the presenter. So we'll be getting, hopefully, the next few weeks, just some more information on the first learning community. So you can kind of track, put this date, a little date on your calendar, February 19th, 2020, will be our first learning community. Thank you. Next slide. Next slide. So MiamiDade is my FY17 Category 2 grantee. Wow, so long, 2 years. And now they are FY19 Category 3 grant recipient. I have worked with them, and I've seen the tremendous work that they're doing in their county. I won't go into too much detail, like Carol do that. But, I mean, they were, I remember when I first started, they complained that, like, they were so siloed and all the other agencies weren't talking to each other. And it's a great work over the last 2 years that they have done to bring different agencies together. It's just, like, tremendous. And I'm proud as a TA manager to have worked with them and see all the great work that they do and that they will continue to do with the FY19 Category 3 grantee. So I'll pass it on to Carol to give an introduction of herself and maybe MiamiDade and their project and just the experience as a Category 2 grant recipient, the TA process, and just, any words of wisdom for our new FY19 cohort. Carol?
Thank you, Laura. You're making me blush a little bit over here. So my name is Carol Caraballo, and I'm the Vice President of Behavioral Health Services with Thriving Mind South Florida. We're the behavioral health component of our police and mental health collaboration grant. So to tell you a little bit about our organization, we currently receive approximately $89 million in state funds to provide behavioral health services for both children and adults that are indigent or low income. So those individuals that don't have insurance or their insurance isn't really covering their services. So we cover 2 counties with that amount of funding, and we cover everything from outpatient services in the community to the most restrictive level, which are crisis units or residential inpatient programs. So that's just, the short end of what it is that we do. So our police law enforcement partner in this grant is MiamiDade Police Department, who is actually the sheriff's office in Miami-Dade County. They are the 8th largest agency in the nation in the Southeast, and they have a little over 3,200 sworn officers in that police department. So like Laura mentioned, we are a fiscal year 17 grantee for this police and mental health collaboration grant. And just to get us started, we started meeting monthly. We decided who our essential group of individuals that were going to help us carry this forward, and we started meeting on a monthly basis and trying to figure out how it is that we're going to get all of our stakeholders together and really start sharing information and deciding what were some of the needs in our community that we really wanted to address with this opportunity. So one of the first things that we did in February of 2018, February 13th of 2018, was have our first community stakeholder meeting, which we used the sequential intercept mapping model. We brought together various stakeholders, including area hospitals, both private and public. We brought our homeless providers, all of our behavioral health providers, and multiple law enforcement agencies, veterans administrations, everybody that we thought that could have some input into the community and what the needs were that we could start addressing. With the information that we gathered, we looked at what some of the existing services that we currently have in our community are, and looked at how we can address some of those gaps and look for some opportunities for changes. One of the things that we wanted to develop with this opportunity is to basically create a strategic plan for our community that we can present to the County Board of Commissioners so that we can move this program forward. So in order to do that, we hired an evaluator as part of this opportunity, and they were looking at various policies that would be affecting our work. So we looked at various privacy sharing policies, some school policies, confidentiality, those kind of things. We took full advantage of our site visits. We actually went to 4 different sites. We visited Los Angeles, Tucson, Houston, and Portland, and I can't stress enough how important these visits were for us, because we were literally able to take a look at some of the activities that they were doing and how they were implementing police and mental health collaboration. So we didn't have to reinvent the wheel. We looked at what they were doing and then brought it back to our community and looked at what are some of the ideas and some of the programs that they have that we could also, implement here and maybe tweak them so that they would be better able to address some of our needs. We kind of like how Laura mentioned, we were also tracking a lot of our things on an Excel spreadsheet. Because we really don't have a data system, or we don't have a shared data system where police and behavioral health organizations can speak to each other. And unbeknownst to me, a lot of law enforcement agencies obviously don't have the same data system as well, so you don't have the same information. Behavioral health providers don't share information in this manner. So as we noticed that was definitely a gap that we wanted to address. So one of the first things that we did was we took a look at our release of information form that we are using as an organization and that our network providers use. And we handed that over to the attorneys, and we asked, how can we share information with law enforcement of some of those high utilizers that we're seeing that are affecting both systems? So after it got reviewed and all the privacy laws were reviewed, we were actually able to come up with a consent form that our consumers that we're interacting with are able to sign that allows for us to actively interact with police and obtain and share information. So Laura has access to that, and happy to share that with all of the grantees so you can take a look at what that looks like, because that really has been essential in the work that we're doing forward. Based on our different site visits and our TA calls, we decided that we wanted to move forward and implement a co-responder model, and that's part of what we're doing with our Category 3 grant, and we're excited to be able to have that opportunity to move that forward. And that was based on the various site visits that we did and, looking within our community and seeing what was something that would better address our needs. We were able to then create a strategic plan that was presented to the Board of County Commissioners back in May of this year, and that was actually approved. And one of the things out of that is now the development of a task force. So Laura mentioned how we were first kind of siloed and just worked with Miami-Dade Police Department. Now the Board of County Commissioners has approved for the development of this task force, And we now have within our Miami-Dade Police Department's Threat Management section, which is a newly formed section that started with this grant. We have a City of Miami Police Department, who's another one of the biggest law enforcement agencies that is now embedded within our collaboration. We actually have federal partners. So the United States Secret Service has actually partnered with us. We're actually looking to work also with the FBI has also expressed interest in joining our collaboration, and some various other local and federal partners that are now working with us in what we're doing. As far as our monthly TA calls, I would recommend that you take full advantage of them. I know that we're constantly working with Laura and asking for additional resources or policies or anything that would help us, even if we maybe had questions, we're not sure how to proceed. We really took full advantage of those opportunities, and we really maintained relationships with those individuals that we visited throughout the county, and still call upon them now as we're moving forward with our next phase in our category 3 grant. So that's a bit of an overview. I'd be happy to take any questions at the end. And I know that Laura has all of our information and can share that out if anybody wants to reach out to us individually.
Thank you. Thank you so much for that, Carol. Like Carol said, if you need her contact information or anything, please feel free to reach out to your TA provider. We love to connect grantees together, former or current grantees. We just want to keep that collaboration going. So thank you, Carol, for speaking and just being able to share your TA experience and your Category 2 experience with this new cohort. Thank you. Next slide. Okay. So we are going to, I feel like we have spoken enough on our end, so we are going to open the phone lines to the FY19 Category 2 grantees. We're going to have a roll call, and also we just want to hear maybe just a short snippet of your program description, your initiative, and also ask any questions that you may have, whether it's towards me, Carol, or Maria, about the TA process. So we're going to start with the Phoenix Police Department. Do we have anyone from Phoenix on the line? Sorry, I think it was muted, so I don't know if Phoenix. Do we have anybody from Phoenix on the line?
What are you wanting to do? I don't want to go, but I don't want to not go. That's kind of right.
Can anybody who's not from Phoenix, can they just mute their line? I think we just mute everybody at once.
Is it Friday? Oh, it's Friday.
Hello? Anybody from Phoenix? If for whatever reason, if the phone is not working, maybe you can type it in on the bottom of your screen, the right-hand screen during the Q&A, so at least we know that you're here. But so we'll just move on to Colorado. Is anybody from Colorado on the line? There's some people who are, sorry, muting everyone. Can you just mute? From Division of Criminal Justice in Colorado. Is anybody on the line? Colorado? We have some people who are on. About Warren County. Boston Police Department.
Hello, Jason White's here.
Hi, from Boston?
Yes.
Hi, Jason.
Hi, how are you? I'm actually filling in on the webinar for Jenna Savage, who is our program director. I'm the grants manager here. Jenna, Mike Stratton, Deputy Mike Stratton, and a group of people are actually on their way to the PARI conference, so I'm filling in, covering this webinar for her. And I mean, currently where we are right now is that we're waiting for our original budget to be approved in the GMS so that we can submit a subsequent budget revision for approval. But we're here and we're getting the work done.
Great. Thank you, Jason. So Boston is one of my former Category 3s, and now they're Category 2, and they are looking, they have a co-responder model with a bus clinician. So I'm excited to for them to continue the TA process with us. So thank you, Jason, for being able to do this. Yeah.
No, thank you very much.
Thank you. City of Muskegon. So there are some people who are unable who are unable to get their microphone to work, so they are actually writing in. So we are getting all your messages, and we're going to try to unmute people. And if you are not speaking, can you just mute your phone so we don't have everybody's background noise, if that's possible? We'll try this one more time to see if that works. You can also try clicking the microphone button on the bottom of your screen to see if that will work. We really want to hear from you. So we're going to try this again. Apologies again. Sometimes, technology is not my friend. So apologies for making you guys jump through hoops. So we will go with anybody from St. Louis here? I'll go through the list again, but we'll start with anybody from St. Louis? We will try to unmute you. Anybody from St. Louis? Anybody from Clemson University, South Carolina?
Can you hear me? This is Brian Miller from Clemson University.
Hi, Brian. Yay, we can hear you.
How's it going? I'm the academic partner. I'm filling in for Lieutenant Harrington. He's stuck in a meeting right now.
Well, we're glad to have you on.
Great.
So, do you know anything about the initiative? I know you said you're filling in, but do you know anything about the initiative?
Yeah, we're still in the early process. We're trying to plan a meeting in January to try to bring together all of our stakeholders, but we're really kind of early on in that phase.
Okay.
So partly what we're doing is all the university officers are getting trained in CIT, and then we're going to also do some train-the-trainer courses since we have a lot of law enforcement coming into the area anyways. We're going to try to create kind of a hub and outreach. Our mental health partner represents the 3 surrounding counties, and the university is kind of centrally located right in the middle. So it kind of gives a good geographic orientation to provide these services.
Yeah, great. So that's exciting. So I don't think I've ever had experience working with a university. I know we have a university as one of our learning sites. So definitely excited to have you as one of our cohorts. And I think your team provider, I'm going to probably pick their brains. So congratulations to Clemson University. Thank you for joining. City of Lubbock in Texas.
Hello?
Hi.
Hello. Hi, I'm the academic partner with the City of Lubbock. Can you hear me?
Yes, I can hear you. Sorry,
Sure.
I'm going to say, if you are not speaking, do you mind just muting your phone? There's some background noise. Apologies.
So this is a bill, our Cat 2 grant builds upon our Category 1 grant. And so we've already formed a Justice and Mental Health Collaborative. Our Category 2 grant will build upon that, and we're going to build upon
Hey, how are you?
I'm sorry. There's somebody else talking. Can you mind just muting your phone if you are not the person speaking?
Yeah.
It's getting kind of a little hard to hear. Apologies. Okay.
Yeah, when I go to open the individual reports, I get a...
Brian? Obis? Okay. Go ahead. I'm sorry.
Okay, so we are building upon our Cat 1 grant, and we're going to build a cross-training crosswalk, not only in the city of Lubbock and the county of Lubbock, but we're going to do it with the 8 surrounding rural counties. And so we already have a Justice and Mental Health Collaborative formed, and we're going to build upon that and figure out all the training needs, the collaboration needs, and then try to coordinate all of this. And so we have started a bit, but we are still really in the organizational phase. And so we do have our behavioral health partners is Covenant Hospital and Star Care. We have the university, we have the police department, and we have the county sheriffs and court administration all involved.
Oh, wow. Good. So you guys already have some great stakeholders on board. So congratulations to the city of Lubbock. Great. So we're going to just maybe go through this one more time to see if maybe any technical difficulties, they got better. So if anybody here from the Phoenix Police Department, and if you're unable, because we can't hear you, maybe you could just mind on the bottom right-hand screen just saying, here from Boston, just so we know that that there's somebody from Boston attending. So Phoenix, not Boston, Phoenix. Division of Criminal Justice in Colorado.
Can you hear me now?
Yes, I can hear you.
Okay. Our project is a statewide project, and we have 90-some public safety answering points, which are 911 operators, and we have statewide crisis services. And so we are meeting together to figure out what behavioral health crisis calls that come into 911 could be diverted to like our crisis line or have mobile crisis or co-responder units dispatched out to deal with the crisis rather than just law enforcement and EMS.
Wow, okay. That's going to be really interesting and fun. So thank you so much. Really appreciate you being able to join us and share that. Warren County, anybody from Warren County on the line? Anybody from City of Muskegon? Anyone from City of St. Louis? Okay. So we did have somebody from Warren County. That is correct. So he was able to type in that. Unfortunately, due to technical difficulties, he's not able to speak, but somebody from Warren County is on the line. So if I said your jurisdiction and for whatever reason we were not unable to hear you, please let your TA provider know that you were present during this webinar. If you have any questions or anything, please type it on the bottom right-hand of your screen while you have some TA providers and Maria on the line. We want to answer any of your questions that you may have just about the TA process, or Carol, about the TA process. If you have any BJA questions, any questions that come to mind, please feel free to type it on the bottom of your screen, and we'll make sure to field those questions to the appropriate people. A minute. Okay, so we do have a question. It said, I still have, one question is, I still have not received a TA contact or the guide, a copy of the planning guide. Do you know when we'll receive that? So the guide, your TA provider will be sending out the guides to you shortly. It was just received them. If you, at the end of the presentation, you are going to see our contact information for the law enforcement team. And so feel free to email one of us, and we will make sure that you are connected with your TA provider. You also may want to check your spam folder, because a lot of times that has happened, me sending emails and me trying to get emails, that it may have gone to your spam folder when we try to contact you. So you probably want to check your spam folder. But if you send from one of us an email, contact information will be shown. We will make sure that we connect you and send you your contact information to your particular TA provider. We'll do that as soon as you send us the email, which has within the 24 hours. Hopefully, you'll get you'll get that contact information. As in the guide, you'll be receiving your guide shortly. So either you'll receive it during your right before your first phone call, if you schedule one with your TA provider, or you'll be getting a separate email. But we just received it back, so we will be sending out the guide shortly. Can we get a copy of the PowerPoint with links information? Yes, this webinar was recorded, and so when you get it back, we will be able to share, give you a copy of this webinar. Any other questions? We'll give that just a few more minutes. Oh, we have somebody from Muskegon Police Department. They're here. Hi, Muskegon. We got you. Thank you so much. When do you expect the budget to be approved? Maria, I would let you answer that.
Thank you. I wish I had a solid answer for you. There is an internal process, and it does take some time, but it will go through the programs office, then it'll go to OCFO, usually, and then come back. Usually what happens is programs office will receive it. If they have initial questions, they'll send those on back. And then you would respond, and then it would go to OCFO, and then they can even have additional feedback and send it back. So you can see there could be a lot of back and forth. If the budget there's no question whatsoever, you've got all your calculations in there, it's explained, you can tie it right back to the narrative and to the timeline. There's no issue whatsoever. It could be basically, I've been telling folks the end of this month. If there are issues and there's lots that's left to sort of explain, then it could be several months. But hopefully, for Category 2, the budgets are not that large. And I would say be watching GMS and make sure that the contact information that you have in GMS when you applied is still current. I can't tell you how many times when an organization applies, 6 months ago or so or more, people have changed and contact information's changed. So when this information comes back, they don't have, maybe we don't have the appropriate contact information in GMS. So I would say first and foremost, make sure your contact information is correct so that you can receive the feedback from programs in OCFO, and then I would say respond, as quickly as you can, as clearly as you can, and then after all of that, troubleshooting, if your budget is not cleared by, I would say, the second week of January, we definitely want to be hearing from you. So reach out to your TA coach or reach out to me so that we can start tracking that and figuring out what the issues are or where the hang-up is, where maybe, a message went out, it wasn't received, or it was received, it wasn't answered to the satisfaction of OCFO. So we might need to do some tracking and some troubleshooting there, but I assure you by the second week of January, I'm going to be looking for everybody. And I want to make sure that your budgets are cleared so you can do the work, because it's important. You need to have the funding to be able to do the work. So I get that, and I do want to hear if there's any trouble. Thank you.
Thank you so much, Maria. You guys, I know BJ's, you guys have a lot of stuff going on there, so thank you for that. And just a little tidbit, during your first phone call with your TA provider, just let us know if your budget has or has not been approved, because we do have monthly frequent contact with BJ, and so it's good for us to let BJ know, hey, the budgets have been approved or the budgets have not been approved. So during that phone call, just give your TA provider a heads up whether it has or has not been approved, just so we can make sure to keep tally to provide that information to BJA, because there's a lot going on over there. So we understand sometimes when it doesn't get approved or not as fast. So we have another question from MiamiDade. What would you recommend to a new team that has not had a grant before?
Hi. So we've actually had a couple of grants before. I think one of the first things is really getting in line your main collaborators and those individuals that are going to help you to push your vision forward, and having those that really have a stake in the work that you're trying to do. Getting the buy-in from our leadership from the beginning, and from the police department, and the leadership in the police department, I can say was crucial in them allowing us to, be creative in our ideas and some of the things that we wanted to do, and allowing us to try those things out. So I think having the right people in the room is one of the first things that will help you to move forward, and then knowing or figuring out who it is that you need, that you may not have at that moment, and what organizations that you're going to need in order to push your vision and really get the work that you want to do to get that done. So I think it honestly really starts with having the right people involved and having your vision and what it is that you want to accomplish.
Thank you so much, Carol. And I'll just add that, in the first one or two exercises in the planning guide, I talked about stakeholders and who to invite and who do you want to be part of this group and what are their roles. Because sometimes, selecting people to be part of this initial group is fine, but they may not be needed towards later on. So just making sure that you invite the right people to the table. So that will be something that your TA provider will be able to help you with on who to invite to the table and how can they push this initiative forward. So thank you so much for that. So if I think those are all the questions for right now. If you think of any more questions, please, next slide, please. Yeah, so this is our contact information. If you think of any other questions, or if you just want to reach out because you do not know who your TA provider is, you can reach out to myself, Laura Fabius, via email, probably better, or Olivia and Randy, contact information, and we will get back to you and we will let you know who your TA provider is and send their contact information, because it may be us or it may be someone else. So please feel free to reach out to us, Olivia or myself, and we will make sure to get you connected. If you want links to some resources, if you want a copy of this webinar or another webinar, please feel free to reach out to your TA provider if it's not one of us, and we will make sure to get you connected. So we'll leave this up for just a couple, maybe just a minute, so everybody can be able to write down our contact information. Okay, next slide, please. Thank you. So next step, So if you have not yet done so, please respond back to the congratulations email sent by your TA provider. By now it should have went out. So it may, if you have not received one, it may be in your spam folder. So maybe you want to go back and just check that to make sure it was not sent to spam, because that has happened before. Schedule your first call with your TA provider and respond back with names and titles, organization, and email addresses of everyone expected to be on the first call. So everyone that you think is going to be, everyone that you think that is a part of this project, you want them to invite them on that first call just to be able to help answer questions. And also may want to note, yes, that if you have not received the congratulations email, it may have went to the point of contact person that we got that information from BJA. So you may kind of want to reach out to who you think may be the point of contact, or just send myself or Olivia an email saying, hey, I'm from Lubbock or Muskegon, and I did not receive that email. Congratulations email. We'll make sure to send you a copy. We'll be sending out some dates for the first strategic planning learning community on February 19th, 2020. So please keep a lookout for that. You can contact myself or Olivia with any questions or comments, and we'll send out the registration link for the learning community. Next slide, please. A big thank you to Maria and Carol from Miami-Dade. Thank you so much for taking the time out to be part of this presentation. We really appreciate it. And a big thank you and congratulations email to our FY19 Category 2 cohorts. We look forward to working with you over the next 2 years and help pushing this, your initiative forward. So thank you for being able to join us. This is recorded, so if you would like a copy, please reach out to your TA provider, and we'll make sure to be able to give you a copy. Thank you once again, Carol, Maria. Big thank you from CSG, and I hope everybody has a great rest of their day.